Well, new today, the number of people ending up in a hospital from COVID-19 increased in 42 states over the past week. That's from Johns Hopkins. For context, we turn to Dr. Esther Choo, professor of emergency medicine at Oregon Health and Science University. Dr. Choo, thank you.
Nice to be here, Shep.
Doctor, cases are spiking, hospitalizations are up, can't dispute this. Are hospitals and medical professionals prepared for the surge? Can the system handle it?
Well, there's going to be a little bit of an unknown factor here, but I think we have some good news and we have some maybe concerning news. The good news is that we spent all spring preparing for just this. We didn't know what we were getting in terms of COVID. There were some projections that had us way over baseline capacity. So we spent much of the spring and early summer building in extra capacity, oftentimes extra physical capacity, transforming our spaces so that we can accommodate many more people and creating protocols and procedures so that we were equipped to handle all kinds of surge in patients while also keeping staff and patients safe from contracting the disease. So we're in a totally different situation than we were in the fall, in that we've invested a lot of time and resources to be prepared for almost anything. I think the issue is that we are now headed into COVID colliding with influenza, and we just can't anticipate how much extra volume those colliding viruses will cause us.
Doctor, since you mentioned that, there are some indications, correct me if I'm wrong, from South America, where flu happens at a different time of year, that all the masks and all the hand washing and all the pay attention has made flu not so bad. Could that happen here? And is that what you're seeing, or do you know yet?
We don't know it yet because flu hasn't hit us, but you're right. These things like social distancing, face mask wearing, extra hand washing, those things will actually affect any virus. So it's possible that we'll see different epidemiologic patterns this year because of what we're doing for COVID. It's way too early to tell. And of course, all these things depend on people actually doing these things. And in places where people are not as careful for COVID, I think there will not be as much of a chance that it could curb flu as well.
Well, areas have been identified across the country, some in the Pacific Northwest, some in the Midwest. There are other areas, you know them, we've talked about them. In those areas, with this combination of flu and a surge, which you and all of your colleagues are predicting in COVID-19, are you concerned about ability to handle things there?
We are concerned everywhere. And, some of the things I mentioned, we have taken care of. We've put in a lot of protocols, a lot of policies and plans for surge. But I will tell you, there were some fixed resources that we haven't really managed to make a dent in. Things like personal protective equipment. We have not stopped running out of it.
You're still running out of PPE. You don't have enough masks. You don't have enough gowns. You don't have enough for hospital workers, even still.
We are still reusing and reusing things that are normally single-use items like N95 masks.
Why isn't there enough for our doctors and nurses?
It's the big question. And part of it is that these supply chains are very complicated and cannot be ramped up quickly. Part of it is that we haven't mobilized existing resources by invoking the Defense Production Act. Part of it is that there's worldwide demand since this epidemic has affected everybody. And so it's really multifactorial.
Right.
But all these months have not solved this problem.
So there's not enough. And if we don't want to have a surge and put you and your colleagues and our heroes across the nation who are frontline medical people at risk, we got to do our part, wear our stuff and wash our hands. Is that a bottom line?
That is the bottom line. The only thing we can do to allow health systems to function well and give the sickest of people the best care is to do as much as we can upstream to limit the number of people who come to us. So mask wearing, social distancing, avoiding large indoor gatherings, these have never been more crucial.
Dr. Esther Choo, it's great to see you. Thank you for your service. We'll speak with you again soon. Shepard Smith here. Thanks for watching CNBC on YouTube.